Today, we'll be talking about exercise and pelvic health for pregnant and postpartum parents. Crystal Stauffer is our presenter today, and Crystal has worked in the trauma surgical ICU for 10 years as a nurse at Harborview Medical Center. Outside of work, Crystal is a new mama of a very active 2-year-old. She is a licensed Zumba instructor, having obtained her ACE personal training and TRX instructor certifications while pregnant, and is a certified pregnancy and postpartum athleticism coach. Crystal's mission is to improve education, encourage discussion of common experiences, and provide parents with the help and support they deserve, especially during pregnancy and postpartum. Crystal's going to be diving deep into core and pelvic floor function, pregnancy impacts, common postpartum experiences, and exercise modifications that can help. With that, I'm going to go ahead and pass it off. Crystal, we're just so excited to have you here today, so thank you.
Thank you. And thank you all for being here. I pretty much summed up the first part of my presentation here, but this is just a list of my certifications and credentials, and need not say more about that. But basically, the reason why I'm so passionate about this is just because of my life experience. So my entire life, I've been an athlete since I was 9 years old, playing sports, and then got really into weightlifting when I was in my early 20s, and then just kind of went through these ups and downs of like getting really in shape and falling off the wagon and so on and so forth throughout life. And right before I got pregnant, I got in what I would describe as the best shape of my life. And I was operating under the idea based off of the advice I'd received from practitioners and fitness coaches that, like you can just do whatever you want and listen to your body, and thinking that I would just bounce right back to my previous state of athleticism. And that's just really not how it went. And so that sent me on a quest to find better information. And you can Google a lot of things and you can get a lot of information, and some of it is good and some of it is not helpful. And so I just really feel passionate about getting this information out to people, so that you know that it exists, because it's pretty recent that a lot of this information has become available. And I am just going to throw it out there. Like she said, I'm a new mom. Well, you can call me new. He's 2 years old. He's all over the place and I love him dearly. But it's really hard to get anything done. So I've been sitting on this information for almost 2 years now and wanting to do something with it. And while I'm not quite at the point where I have everything in life organized to be able to tell you like where I'm taking it from here, I just want to get this information out to people so that you guys know where you can find this information and help yourself and your friends and family and clients and patients if you are healthcare practitioners. Also, another tidbit you'll see here is that I did end up, I was thinking I was so fit, I was going to, that was going to make everything smooth and easy and go to plan. And I actually ended up with, gestational hypertension and postpartum preeclampsia, and then all of the fun mental health things that go along with that. And I personally am a person with pelvic organ prolapse and had lots of neck and joint pain, and just a really difficult time adjusting my expectations of what I ought to be able to do during this season in my life. So the goals of this this webinar today are, I want to encourage discussion about common pregnant and postpartum experiences, as I think a lot of people are experiencing things, but not everyone is talking about it. And some of that's just because people don't realize that it's not normal, or people don't realize that it's help, or maybe they're embarrassed. But it can really affect like all aspects of our physical, mental, and emotional health. And then I want to also bring attention to some of the misguided advice or recommendations that are out there, social media, what providers or coaches are telling us. And it's not that people are intending necessarily to misguide us, but they just also might not be aware of this information's existence. So kind of want to debunk some of those. And then I know Hannah said that I'd be diving deep into core function. I won't be going too deep today because this is just like the tip of the iceberg. There's so much information and we have less than an hour to go over it, but I am going to give you at the end of this webinar strategies that you can implement and tell you where you can go to find more information so that you can start helping yourself and others. So for the purposes of this webinar, I just want to define a couple of things. So pregnancy is going to be the time from conception or anywhere or to full term pregnancy, anywhere in between, regardless of timing or whether there was pregnancy loss, regardless of what that loss was due to. Postpartum is forever. So sometimes we talk about postpartum, the postpartum phase, but really once you're postpartum, like you will always be postpartum. And while being cognizant of, you know, certain language that we're all learning to use better, you might hear me you might hear mom, but for the purpose of this webinar, it's geared towards, I didn't know how best to say this, but anyone who has been pregnant or postpartum, or even if you haven't been pregnant or postpartum, but you have like anatomy that was of like female, being assigned female at birth. I'm struggling here. And I'm not an expert on all of these things, which is why I'm kind of just touching on some of them, but I want to help you find those who are the experts. So the first goal, right, we're going to talk about the common pregnancy and postpartum experiences and how they affect all aspects of our health. So number one, and I know this is pretty, people are aware of this, but there can be physical discomfort that comes along with being pregnant, and especially in the beginning. There's nausea, there's vomiting, you can be bloated throughout, breast soreness, sensitivity. These things all can affect our desire to exercise, or like even, I'm not gonna lie, I can't see my last word here because this is in the way. You just get through the day. Lack of sleep, this can be like while you're pregnant, after you have your baby, for various reasons, as many of us know, you're not getting the rest and digest that you need to be in your best physical state. So trying to push yourself further to like meet some potentially unrealistic goals might not really be the best thing for your body. And we also know that when you're not getting good sleep, like it can definitely negatively affect your mental health and your resiliency. Many people experience pelvic pain, back pain, joint pain, or just pain in general. Swollen hands, feet, all kinds of goodies when you're pregnant. And this also is going to limit the way that we want to move. Maybe usually we like to do, a bunch of burpees, but we don't feel like it because we hurt. And also some of this pain can cause us to compensate and like without even realizing it, which can create longer term issues. And what we need to be doing is referring to pelvic floor physiotherapists early, because you can actually learn things that we would call prehab, like while you're pregnant, things that you can be doing that are going to serve you well in the long run. Another common experience is birth trauma, whether physical, mental, emotional. People can experience different degrees of tears in the vaginal tissue, perineum, rectal tissue. They might have an episiotomy. There could be ligament or muscle injuries, cesarean births, like a major abdominal surgery. There could be bleeding, and regardless of how someone's labor or delivery went, like everyone's experience is individual, and so you can't predict who's going to end up having or experiencing like anxiety or depression or some of these postpartum mood disorders. And obviously that is going to affect your, again, motivation and ability to exercise. I just threw a little tidbit that, this is just like a soapbox thing, but when people are having struggles and feeling like they just don't know why they feel funky like they do, saying something like, well, at least you have a healthy baby, or just trying to distract them with positive things isn't super helpful or productive, because it kind of dismisses the process that they're going through. So this is giant. I don't know why I made it that large. And pelvic organ prolapse is a very common occurrence that I think a lot of people don't even realize is a thing. So this can basically, it's a downward descent of your pelvic organs. So your bladder, uterus, and your bowels and rectum. They can, there's multiple reasons why, and we're going to talk about this. But basically, it's your pelvic floor is like a support for your pelvic organs, and due to strain during pregnancy, whether it's just being alive and growing a baby in your body and putting pressure down the pelvic floor, or doing certain activities that increase the pressure, or how your labor and delivery went, can all contribute to the development of this. Also, it doesn't have to just be if you've had a baby. It can be, athletes, even in like adolescents can be experiencing this. And just as we age, muscles get weaker, tissues get weaker. And so you don't have to be pregnant or postpartum to have this experience. Again, so I'm not the expert in all of these, so I'm not going to try to explain in great detail, like the grades and all of that good stuff, but they are graded 1 through 4, 1 being considered the least severe and 4 being the most severe. But just keep in mind that you could have a grade 1 prolapse, but you might feel like you have a grade 4, or you could have grade 4 and you might not have any symptoms. So it's very individual, and you can't predict just by looking at someone whether they're suffering from this or not. You can also have more than one type of this prolapse. Some of the symptoms of POP are going to result in, urinary, fecal, or flatus incontinence. So, this could be urge incontinence, whether you really have to go and you can't hold it in time to get to the toilet, or you stress incontinence if you're laughing or jumping or running or sneezing. Those make you leak urine. And also you could, in reference to the bowels, you could struggle with constipation or difficulty actually passing stool. Other things you might experience are feelings of pressure or heaviness, like a bulging, like feeling like, your vagina is going to fall out. You might have, and this can be varying degrees. It could feel very severe. It could be just like a slight little burning, or just a different feeling than you're used to. And the deal with this is that how it can affect our mental health, because a lot of times we're being first of all, it's not getting talked about. Second of all, if you bring it up, you're not always getting referred to a pelvic physiotherapist. And also, in our society, it's just really, I can't think of the word, but people don't talk about vaginas comfortably, so we need to kind of change the language around that, because really the vagina is just a muscle. It's more than that, right? But anyhow, but then sometimes when you have these experiences, I can say personally, when I started experiencing this, I felt like, oh my God, I'm going to make things worse. I can't do the things that I wanted to do. And then that was a huge factor in what played a role in my postpartum mental struggles, was just feeling like I was not able to be who I was and do the things that generally provided peace of mind for me. And so people are, sometimes people are silently suffering, or they're looking through the internet for advice and not necessarily getting the best advice. And this last one here, just being told, oh, this is just part of having a baby. So sorry. And that's not really helpful either. So this is a picture of normal anatomy, just to give you an idea of like what I'm talking about, depending on what your level of knowledge of the reproductive system is. So here is your bladder and your uterus. Obviously you guys can read, but this is what it would look like if you didn't have any prolapse. In this picture, the cystocele, which I don't think I've actually termed these yet, or maybe I did, I can't remember, but cystocele is considered bladder prolapse. And so you can see in this one how the bladder's kind of flattened and it's starting to impose on the anterior wall of the vagina. So this can lead to some of the feelings of pressure or bulging, and also can, result in leakage of urine. And then here for the uterine prolapse, you can see normally the uterus is hanging out up here, but it's just, well, it hasn't decided. Some factors have influenced it to descend towards the vagina. So this again can give you those feelings of pressure or bulging, or like things are falling out. And it also, if you notice, kind of affects the orientation of the bladder. So it is possible that this could also be contributing to some incontinence. And then for rectocele, which is like a prolapse of your rectum, you can see normally that it just goes down and out, but in this picture, it's coming, you guys can see my mouse, right? Okay. It kind of bulges out like within the body, but so it doesn't have a straight shot out. So this is where you can have difficulty passing stool, like things can get stuck. Constipation can also be a result of just like the change is that your bowel has gone through by virtue of organs moving around in your body while you're pregnant, or any stress that was put on them while you were actually in labor or pushing the baby out. And you can see with the rectocele, it puts pressure on the posterior wall of the vagina. And so that can also give you some of those sensations of pressure and bulging and whatnot. Another common experience is diastasis recti. So this is a popular term right now. If you're on social media or you're like looking through exercise, what do I do to exercise while I'm pregnant or postpartum, you will see a lot of mention of diastasis recti with a lot of advertisements for fixing it or, bringing it back together. So the technical definition of diastasis recti is a greater than 2 centimeter separation between your transverse abdominals. And your transverse abdominals are a part of your inner core, which we're going to talk about later, that connect to the linea alba, which is the connective tissue between your transverse abdominals. And the linea alba stretches while you're growing a human in your body, and it has to do that, otherwise there is not space. So it's actually a normal process, and everyone who makes it to 35 weeks pregnant is going to have diastasis recti. That doesn't mean you will have it forever. It might mean that you have more work to do afterwards, but it's not. Traditionally, people have said, oh my gosh, you have a diastasis recti, you can't do abs exercises, or you can't do this, or you should do these exercises. But it's not about the width of separation as much as it is your ability to maintain adequate tension in that connective tissue, the linea alba, to be able to support your organs and prevent development of hernias and things like that. And we'll talk a little bit more about the pressure system towards the end of this webinar. So physically, obviously, if your abs aren't quite back to function, say after you've delivered and you're still having struggles with diastasis, is going to affect your ability to move because it's a large part of your core system. It can cause pain, often is back pain, like we talked about, can be putting you at risk for hernias. And also, there can be aesthetic changes, which sometimes you can look at someone's stomach and you would have no idea that they have like a gigantic diastasis, and other times it's very obvious. And so this can, potentially affect people's mental health. Some people are really good about just accepting, I had a kid, my body changed, and that's that. But often it's actually a really hard thing to adjust to. And another thing is that um, there is a lot of stigma around if someone were to opt for a tummy tuck surgery, because there's a lot of body positivity talk trending now, which is good, but we don't want to take it so far to the point where if you've unpacked the reasons why this aesthetic thing about your body is important to you, that you shouldn't, you know, you shouldn't be judged for wanting to have a surgery if that's what you opt for. And of course, Googling and scrolling through things, social media, all that stuff is gonna just cause fear of making it worse and just giving you all these restrictions, and that in turn also affects your mental health because you feel like, okay, well now I can't do what I want to do. So this is a picture of, so these are your transverse abdominals. This is the inner core. So you can see here is the linea alba. So, you know, obviously not every single person is going to look like this before they're pregnant, because there are other stresses in life that could potentially have caused some additional separation of the linea alba before pregnancy. But you can see when you're pregnant, like it is widened and it's necessary. And then it's typical after pregnancy, even when you're fully healed, for you to still have a certain degree of separation. But if you can, you don't need to freak out about it. If someone tells you, oh, you've got a diastasis, like if you are able to manage the pressure, it's okay. And so we need to change language around that as well. Other common experiences are fluctuating hormones. You know, this is happening throughout pregnancy. It happens immediately following birth, to the first few days postpartum. The big one, is any mom may have experienced, like 5 days-ish postpartum is a big change. Hormones that are supporting recovery and breastfeeding, and whether you're starting or stopping breastfeeding for any reason. At 6 months, typically, the hormones can kind of start to settle out. It can happen earlier for some, depending on your nursing experience, whether you do it longer or how often you're nursing and whatnot. Yep, we talked about that. And hormones cause an emotional roller coaster. So like your body is working super hard, like you grew that baby, but you're potentially still growing that baby, and so it's working hard. And this imbalance of hormones, I don't want to say imbalance, but this change in hormones that's frequently fluctuating, it really just, it can make you go cuckoo. But also this is part of what contributes to the postpartum mood disorders. Another common thing that, I mean, you think people talk about it, but I hear a lot of times people still feel like they didn't know this, like issues with latching if you're breastfeeding. Just a little tidbit that's kind of off topic, but pain is never normal. If you got more questions about that, let me know. I'm still nursing my 26-month-old. Another topic for another time. A lot of babies could have tongue ties, which can affect the latch. And for some people, breastfeeding is super important to them and they really want to do it. And sometimes if they don't have the proper support, they don't actually get to have that experience. And so it's helpful to know where, where you can get help, because you can, again, this is kind of a personal example, but I remember being so fixated on making sure that it worked that I kind of put everything else off in my life, and including taking care of myself. So now we're going to dive into some common misguided advice and messaging, and kind of offer alternative advice based off of more up-to-date information. So to begin, what's important to understand is that for a long time, any research done on exercise was done on people who were assigned male at birth. And so around 50 years ago or so, moms weren't necessarily participating in as much of the extreme athletic that we're doing today, like CrossFit or running marathons, triathlons, you name it, Olympic athletes. So it really only has been over the last 15 to 20 years that research pertaining to the considerations specific to our bodies have started to be done. So since we have a different anatomy, there are different considerations. And just like any health or fitness profession, we're always striving to keep up to date with the latest research. And so we have a duty to do that in this regard as well. And as moms, we deserve better education and access to care to deal with some of these things that are super common. Another misguided piece of advice is your body was made to do this. So yeah, your body is made to do this, but it also goes through trauma during pregnancy and birth. So it's, it's not trauma as like you got in a car accident, but it's still tissues change, stretch, get affected, loss of words there. But so we need to treat it as we would any other injury or trauma. So, and it doesn't even matter if your birth was complicated or uncomplicated, so they say, I put that in quotes because like, who's to say what was or wasn't. But you could have a very smooth delivery. Baby comes right out. You have no tears, no issues per se. But then down the road, you could have some leaking of urine. Well, you carried a baby in your uterus that put pressure down on your pelvic floor for 9 months. So it's going to take time to heal. But with any other injury or trauma, we would rehab. So we would rest a little bit, but we would also at the same time is like taking it a little easier, we'd be rehabbing. So, if you break your leg or you have a pelvis surgery, you're going to get physical therapy to retrain your movement patterns and like build up strength before you start actually reloading and pushing it to do things that you were able to do before you had the injury. So that being said, this is why all of these things, your pregnancy, labor, and birth experience, or just literally carrying a baby, can all affect the way in which you return to exercise. Another thing that gets said a lot is believed, I believe this, that the more fit you are during pregnancy, the easier your labor, birth, postpartum recovery, and return to exercise will be. But better advice would be that we are not training for labor or birth, because much of that is out of our control. We are training for life. So, pregnancy is a season in life, one season out of our entire life, and we're in it for the long game. And things that we do while we're pregnant and as we're returning to fitness can have long-term effects on our function and our health, both physical and mental. And if we have goals, if we don't take the proper approach, it could actually set us back from our goals. And in addition to all of that, I know we're talking about rehabbing and getting back to it, but ultimately with some of these concepts we'll discuss at the end, you can actually build your foundation better to a point where you can actually improve your performance. Another one that we hear a lot is just do what you've always been doing, or just do what you've been doing and listen to your body. So better advice is that there are logical, physical, and mental modifications that you can apply during different phases of this journey that you can control, which I won't have time to get into in depth today, but I do have a survey that you guys can fill out and let me know if any of this is of interest to you to learn more about. Because doing this, respecting the different phases of pregnancy and the changes to your body can actually help decrease the potential occurrence of or severity of symptoms of some of those common experiences that we talked about. And it can actually help preserve your function for now and in the long term. Talk about long-term goals. We talked about this already, I realized, but also it's not really like we need to respect the totality of like the whole motherhood experience, right? It's not just our parenthood experience. It's not just our physical activity. There are so many other factors, which of course we'll talk about. I kind of threw this with the other one, but just listen to your body. So better advice would be to offer suggested training themes and modifications based off of the phase of pregnancy, changes in your body and your individual goals and considerations and needs. So this is where collaboration is. This is one of my big tricks, is that we need to collaborate as health professionals and fitness coaches, whether you're an OBGYN or a physical therapist or anything, or a fitness coach. Like, we need to collaborate. So if you're a fitness coach, referring to a pelvic floor physical therapist, and vice versa, is going to help us create an individualized plan for each person. Because in order to provide them with what they need in a way that makes sense to them, their body, you need to understand what their goals are, whether it's long-term, short-term. Are these goals a product of social influence, or is it, like they need to return to work, they're an Olympic athlete, or they're in the military and they have certain physical criteria that are required in order to perform their duties. Also, better to encourage them to ask the question, can I versus should I? So, like, can I squat 200 pounds when I'm 35 weeks pregnant? Yeah, probably. I mean, me? No, I can't, but maybe someone can. But should I? Like, what's the risk versus reward? Am I going to, I could potentially, create extra pressure either out towards the linea alba or down towards the pelvic floor, which could result in some of these postpartum difficulties, could set me back a little bit if my long-term goal is to, say, run for the rest of my life. Another thing that I want to touch on is the idea of athlete brain. And this is a term which I should also mention way back in the beginning. So the pregnancy and postpartum athleticism coach certification was a program created by someone named Brianna Battles, who is she's like a coach. She was a collegiate athlete. She has a master's in coaching and a bachelor's in kinesiology. And she also had some difficulties in her, birth and postpartum seasons. And she also, like, this kind of information didn't exist. Like, it wasn't widely available at that time. And so she went on this mission to, network and find the information and put together this program to create a coach course so that we could, better meet the needs of women, pregnant and postpartum parents. And so what she talks about a lot is athlete brain, and athletes is a spectrum. It could be a mom that just wants to pick up her toddler or get the stroller in and out of the car, all the way to someone who wants to do CrossFit for fun, like just for personal fitness, or in an Olympic athlete. And so regardless of where you land on that spectrum, like, a lot of us are conditioned to ignore the voice in our head that might tell us to, like, slow down or back off or something, because we're trained or conditioned that the harder we work, the better the payoff's going to be. We believe that we're in control of things, and so really what would be helpful is if we are, and I know this might seem common sense for people who maybe aren't maybe if you don't have athlete brain. I know I've encountered a couple people who were like, well, yeah, I mean, not everyone's trying to go back to, intense workouts, but the fact is that there are a lot more of us now that are trying to, and some of us with that mentality aren't good at listening to our body. And so we need permission from people who are credible and understand all of this stuff to tell us, like, hey, this is just a season in your life. Like, you don't have to push it right now. In fact, making modifications and adapting to this season of life will actually serve you better in the long run. So, that's another way you can do it. I just put that little stain in there because I like it. I feel like it applies. Slow is smooth and smooth is fast. So, don't rush in. and overdo it, because that actually might take you longer to reach your goals. And then another term that Brianna Battles uses a lot is intention now for intensity later. So have an intention for why you're doing what you're doing, so that later you can resume the intensity. Another misguided advice would be that you'll bounce right back. And I'm looking at the time and I'm seeing that we're getting really close. So I'm going to kind of go through this a little more quickly. But basically, you can't predict what your postpartum experience is going to look like. Going in with this mentality can potentially set people up for emotional difficulties if things don't go the way that they planned or hoped. And there's just so many other factors, as we've already talked about down here, that go into creating like a training program. It's not so simple as just getting your workouts in. And then another big one is you're cleared, just do your Kegel. So kind of the inspiration for this, the title of this webinar is that better advice would be that your uterus is likely shrunk back to its pre-pregnancy size by now, but the rest of your body, mind, and soul are still in the rehab phase. So you would benefit from seeing a pelvic floor physiotherapist to help guide your return to exercise. And also, you should start scar massage. This is something that a lot of people don't know about, which I didn't know about either, but actually at 6 weeks, if you had a cesarean birth, you should be doing scar massage. And again, I will be providing you a link to where you can find resources for these things. So we've talked about a lot of this already. In addition to all of the things related to pregnancy and postpartum phase, other things that can affect your pelvic core and pelvic floor, just your life tendencies, like activities of daily living, tendencies that you have, or sports that you've played, or injuries that you've had. And so you can, like we talked about, you can start the prehab during pregnancy, and you can actually start gentle rehab before the 6 weeks postpartum that will help facilitate rebuilding the solid foundation. So this idea of just like waiting until you're 6 weeks and going right back to what you were doing before is actually not good advice. And again, this is just talking about, just like any other injury trauma, we would need to rehab, rebuild, and then reload. I'll let you read through this. This is my first webinar, so clearly, we've got some fine tuning to do, but I feel like a lot of it's kind of redundant, and my dog is hacking. One moment. Sorry about that. Make it intense. So again, collaborate. Think about where people are at. We don't want to just prescribe like stretches and clamshells to a person who was like doing CrossFit 5 days a week and is really itching to get back at it, because chances are that they're not going to do it, and then they're just going to go back to CrossFit and potentially injure themselves. And as far as the Kegels go, I feel like I talked to a lot of people who are still being told by their providers to just do your Kegels and then just ease back into it. But in fact, Kegels are not the prescription for everyone, because you need a pelvic floor physical therapist to assess whether you have a hypertonic or a weak pelvic floor. Both situations can affect things like, can cause urinary incontinence and whatnot, but you have to know what you're actually dealing with before you can say whether you need to be working on techniques to relax or techniques to strengthen, or a combination of both. And diastasis recti, a lot of times people are getting assessed while laying on their back and told to like take a breath, and they feel the abs and they say, okay, you do or you don't have it. But really what would be better is to assess for it during like actual movement. So getting someone in a squat, or while they're standing up, or doing a push-up and things like that, and checking for it then, because that's going to help you to figure out whether they are able to generate adequate tension for that movement. And if they're not kind of meeting that goal, then you can scale back and do some more rehab before progressing. And then there's a lot of extremes that are given. Like you can do whatever you want, as long as it feels okay. But really, again, we don't always know what feels okay, like feels different, but it doesn't feel bad. Should I be doing it? I don't know. But better advice would be that training can be adapted and will actually still support your goals. It's not always about what you're doing, but how and why you do it. So good questions to ask, like, why do you want to do this? If it's because you're like you're me and you're worried that you're going to lose all the progress that you've made, or you're trying to prove something to yourself, or comparing yourself to others, or you want to look like you never had a baby. These are questions that, honestly, another topic for another time. We need to kind of unpack where this is coming from. I will say a lot of it is societal influence. We talked about the can I versus should I. Talked a lot about this, and just remembering that adaptability builds resiliency. So learning to go with ebbs and flow of life changes and circumstance can actually help you to sustain exercise in a way that, you know, you won't necessarily have these ups and downs, but you can figure out a way to stay active through the different phases of life. We talked about restrictions. Some of the general ones are: don't get your heart rate over 140, don't lift over 20 pounds. Like, that's not really realistic for some moms because they have toddlers they have to pick up. If they're going to do this movement anyways, we need to educate them on how to do it safely versus telling them just to not do it. Telling someone to just do this type of exercise when they're like, I don't like that type of exercise, like, that's not going to go very far, and they're still going to do what they want to do. So we need to have a better plan in place that supports them where they're at. Then, okay, ACOG guidelines, those are like a lot of what people use, coaches use, providers use to guide like what you should and shouldn't be doing while you're pregnant or postpartum. But we have to realize that this doesn't incorporate our core and pelvic floor health. It's mostly focused on the well-being of the baby, which is obviously very important, but again, there's more than just the baby. Same fear mongering, saying like, if you do these things, you're going to make it worse. And then get your body back messaging. So anytime there's like advertisements for getting your body back, it's better messaging would be like that our bodies and abilities are always going to be changing, and we can't go back, we can only go forward. And even though life will be different doesn't need to be bad. The fitness industry is really good at preying on our insecurities, telling us lose the baby fat, or, you know, get your body back, and telling us that in order to be desirable or attractive, we need to look a certain way. Again, it doesn't account for all the variables of motherhood. It's sometimes causing people to return to exercise before they're ready, which can cause injuries. There could be feelings of shame or failure, hopelessness if you're not recovering the way that you are supposed to, or things aren't going back to normal. And it doesn't respect like the truly amazing thing that your body has done or is doing. And then give it more time. This is just what happens when you have a baby. Better advice: prehab during pregnancy, rehab during postpartum, and then rebuilding, then progressing, and to be able to manage symptoms and improve function. And knowing that what you're experiencing is common, but it's not normal. So you don't have to accept it, and there is help. I'm going to skip over this one because we're getting close, but basically it's another one of the misguided that surgery is the only thing that will fix it. This is not true. I'm sorry that I have to rush through this part, but I want to be able to get to questions. The strategies you can implement right now and take with you and learn more about. So for health and fitness professionals, you can screen patients and clients for physical and mental health needs, refer them to physical therapists, learn about scar massage and inform patients about it, and then use the concept of learn, control, load, and explode to guide your rehab and exercise programming. So first you need to learn the movement, then you need to be able to control your symptoms. And then once you are at that point, then you can progress to loading. And once you've loaded and your symptoms are still managed, then you can get back to the explosive things like running or CrossFit or any of those extreme things you might want to be doing. Communicating that there's no timeline for progression. It's literally just readiness of your skill set and strategy. considering what their goals are, their everyday demands, what their limitations are, their symptoms, what if have they mastered for step one before they go on to step two? Do they need to regress a little bit and focus more on the learning control before they go forward? Sometimes you know, it's not linear. You're not going to always just go forward. You might take 2 steps forward, 1 step back. Talked about that. You know, exercise, all that stuff will really be there, but this time with your baby is like a very short and special season in life. So we need permission, give them permission to slow down, and just knowing that if they do have symptoms, it doesn't mean that they're failing or they're never going to be able to do again. It just means they need to go back to the basics and try again, or like work on it more. And for yourself, you focus on what you can control. So you can't control what your labor or birth or postpartum experience looks like, but you can get help from a pelvic floor physical therapist. You can ask if it's not offered to you, you can ask, get tips on how you can do prehab and what you should be doing in the rehab phase. And then just surrendering to the stuff that you can't control. Again, we just talked about this probably 12 times. So Hannah, is it okay if this is like the good part. I know we were supposed to have 20 minutes for questions, but.
No, we've got plenty of time for questions. I mean, even
Okay.
5 minutes is sufficient. So take your time.
Okay. So for everyone, what we can do is we can learn the basic concept of the core canister, which is our inner core. And I had big plans on having all these lovely pictures for you guys. I did not get to that because, again, life. But I'm going to break down. I might be able to pull it up here in a different way, but so a lot of times we think about our core as just our abdominal muscles, but actually our core is better to think about it as a canister. So it's like you think about a pop can. The top of the pop can would be your diaphragm. So that's a major respiratory muscle that it expands during inspiration and contracts during expiration. Your transverse abdominals, which is hard for me, well, I mean, you see they're like in this area. That's what is the front of your canister. It's the deepest layer of the front of your core and is connected to that connective tissue, the linea alba. It helps protect your abdominal organs from trauma and injury, and it helps the anatomical position of your organs. And when you contract your transverse abdominals in response, your pelvic floor actually contracts. So multifidus are muscles along your spine. This is like the back of your canister. It's essentially like, it holds that place. Obviously, it provides stability to the spinal column and different movements. The pelvic floor is the bottom of the canister. So pelvic floor is like an overarching term for like this combination of muscles. It's the base of the abdomen. So it often isn't thought about as part of the core, but it is actually all connected. Again, it supports your organs and it controls the continence of urethral, anal, and vaginal orifices, as you will. So the coordination of this system is influenced by pregnancy, injury, our life tendencies, things we're doing in our everyday life. ADLs is activities of daily living, exercise, and strategies that we use. So strategies refer to breath, pressure, tension, positioning, and movement, and different ways that we utilize these can preserve function, decrease occurrence or symptoms of pelvic organ prolapse, diastasis recti, and I threw this random abbreviation in that I didn't talk about, which pelvic floor dysfunction is mostly referring to symptoms of incontinence and different mobility issues, and pain and performance. So how we breathe affects the pressure in the core canister and can add or decrease stress on an already stressed system. So for instance, if you tend to hold your breath when you're going to pick something up or do any type of movement, you hold your breath and it's actually pushing pressure down on your pelvic floor. So this could be contributing to symptoms of leaking and incontinence. If your tendency is to chest breathe, so I should have had a better setup here, but if you're breathing into your chest, then you're potentially putting pressure out into your linea alba, which can further stretch that connective tissue and can contribute to diastasis recti. And then these are just a few examples. There are many more breath strategies, but the ones that we talk about a lot in the rehab phase is the connection breath. It's called different things, but it's by doing this, it's evenly distributing the pressure in your core canister instead of pushing it out, down, up, what have you. It's like you're expanding everything like a balloon. So we're going to practice this, but I feel like it's going to be helpful to get to the part that explains how to do that before I have you practice it. Another tendency is a lot of us have tendencies to hold tension in different parts of our body, oftentimes without even realizing it, and that can affect our breath strategies, our posture, positioning, and alignment. So a neutral posture would be if your body weight is in your midfoot, you have your ribs stacked over your pelvis. So versus like ribs out, butt out, or butt tucked and, ribs gripped, it can, you want to keep your ribs and pelvis stacked, keep your glutes or your butt and your abs relaxed. So people like myself that have been walking around with your stomach tucked in since they were 7 years old, takes a lot of practice to just let it go. And then same with the glutes, because that if you're gripping in certain areas, then it's going to be difficult for you to use breath as a strategy to distribute pressure evenly. And every muscle must relax before it can contract. This is my first time. So like if you think about, if you're already holding tension in, say you're sucking your stomach in or you're gripping your butt, then when if in order for muscles to contract, they need to relax, you're already in a state of contraction. So you don't have much further that you can go. So you can't adequately distribute the breath, and you can't maintain the stacked posture that allows for the breath to be evenly distributed. So it's all kind of connected. And I know this is getting really condensed and quick here. So we'll probably just have to do another one of these that goes more into depth on this. But this is stuff that I just talked about. But what you can do. So right now, this is just one experiment I want to do. So if you're cool with it, I want everyone to just like tense anything you can in your body and everything all at once. So like you're tensing your neck, your jaw, your fists, your abs, your butt, your legs, everything. And then relax it all and just literally let everything out. And the idea is that you can kind of see where the pressure goes when you create tension and how it can get distributed when you relax. So paying attention to, just like in everyday life, if you just notice what your tendencies are, this is what you can take with you today. If you tend to, suck your stomach in, let it out. If you tend to grip your butt, let it relax. If you notice that you are always looking up, try and look forward, maintain this neutral position, and see if you notice any change in symptoms that you might be having, or for instance, low back pain, thinking about tension to task. So you don't need to do like a breath hold to pick up a piece of paper off the ground, but you might, as you progress down the road, might want to do that technique to do your 200-pound barbell squat. Spreading the load, thinking about distributing tension in different areas will all help with this pressure system. And yep. It's a really good ending. Basically, that was a very, very nutshell version. I'm interested to see what questions you all have, but basically connecting the dots of all that strategy just in your everyday life, and then translating it into exercise, practicing just letting tension go and trying to like breathe equally into your belly, your chest, like as a balloon, is going to, over time, facilitate automaticity, so that when you are exercising, you have better tendencies that can decrease pressure and thereby symptoms, or potentially causing complications. So that was a lot of information in a short amount of time. again, my first time. So hopefully you got something from it and you're not leaving just totally confused, but I wanted to just say thank you for showing up. I'm interested to hear from you. Again, I had plans that I was going to put all kinds of resources here. Didn't get to that, but if you go to the wholemovement.com, that is a website that is currently under construction, but there you will find all kinds of links and resources to people who have existing fitness programs that meet all of the things that I was talking about today, as well as just over time, little by little, I'll be adding various resources for just general mom stuff. And you'll be able to find links for physical therapists. And there's a survey on there that I would love it if you could fill out, whether it's just feedback about the webinar, something I could do better or different, or anything that struck your interest you'd like to learn more about, or if you're interested in collaborating, you can fill out that survey and you will know when more information is available.